Okay. Well, good evening, everybody. Firstly, thank you so much for joining us this evening. We're incredibly excited to have had an overwhelming response to this evening's webinar, where we will be talking to you about Towards a Healthier, Happier Britain, the case for health coaching. And in the chat this evening, everyone, as they're coming into the meeting, we're asking them to just let us know who they are, where they've come from, what their interest is, what sector they're from, just so that we can have a really good picture of the kinds of folks who are interested this evening. We have over 200 registered for the webinar. We're not expecting everybody to actually be here this evening, but everybody who has registered will get a recording of the proceedings, and we'll be able to access it from the website afterwards as well. So without further ado, I will introduce myself, Isabella Natrins. I'm the CEO at the UK and International Health Coaching Association. Ines?
Hello, my name is Ines Kerr and I'm the Director for Business Growth and Innovation at UKIHCA.
And this evening we're going to be talking to you about the white paper that we've written and why we believe it is going to provide a platform for integrating health coaching into every aspect of society where we want to see an improvement in public health. So I will now screen share. And away we go. Okay, so you will have seen, guys, I'm sure this graphic all over social media. So it is Towards a Healthier, Happier Britain, the case for health coaching. The webinar this evening will outline what we have in the white paper and take you through it so that those of you who have read it will be reminded of the key points that we'd like to make in it. And those of you who haven't yet read it will have a primer for going through it. So we are obviously the UK and International Health Coaching Association. We were established in 2018 as the first professional body for health coaching in the world. We are non-profit, and as you probably know, health coaching is not a regulated discipline or profession, but we are self-regulating through the work that we've done over the years. Our vision and mission are here. We want to see a self-empowered population managing their health and well-being to thrive in life. And we want to see a health coach everywhere, in the public and the private healthcare setting, in education, in workplaces, and in communities. And we are seeing more and more of this. And all of the work we do is towards advancing the discipline of health coaching, the profession for health coaches, and improving public health through those two elements. The white paper, these are the front covers. What we have actually created an executive summary, which we will be issuing separately. It takes out the pain points and the solutions, which we thought was, quite a snazzy title, really. So what we wanted to do is sum up where we are, what the pain points are, what the issues are, and what the solutions could be that we are proposing. So you'll see going forward two reports. One is a summary on the right hand side. The other is the full report. But before we go any further, those of you who are not health coaches may find the labels confusing. So we always like to start off with health coaching. We've heard of health and wellness coaching, health and well-being coaching, wellness coaching, well-being coaching. For us, it's health coaching. There are too many labels, too many nuances, too many dancing around on the head of pins So we talk about health coaching, but what we do say is that health coaching for us at the association is whole health coaching. So what do we mean by health? We mean that health is a state of resilience. Health is a state of positive gain resulting from an individual's ability to adapt to challenges in the totality of their bio, psycho, emotional, social, existential, and spiritual environment throughout their lifetime. So we see health as a lot more than the World Health Organization's definition of health. We see it as a dynamic state that's uniquely individual, and it encompasses one's whole health, environment, and continuum. So we're whole people in a whole context throughout a whole lifetime. And that for us at the association is what health means. And what do we mean then by health coaching? It's a whole person, whole health, whole life approach. It's a client or patient focused. It's what's important to me. It's based on what the client or the patient wants to change. It supports personalised care and supported self-management, two concepts that are hugely important in the NHS. It maintains health and well-being, but it's also an adjunct to preventing and to treating ill health. And it partners with and contributes to the aims, objectives and results of every sector concerned with improving the health of Britain. What health coaching is not, and this is very important to understand, especially if you are not within the health coaching fraternity, it's not a clinical or a therapeutic intervention. It's not giving a diagnosis or making recommendations or giving of expert advice, and it's non-directive. It's what the health coach thinks that the client or patient needs. It's not what the health coach thinks. It's what the client or patient wants. See it as a process of transformation, where transformational health is at the seat of the stool, and we hope to put our clients and patients sitting firmly on that stool. In the centre, we have the client and patient, their needs, their aspirations, their health, their experience, their expertise in their own life. On the left-hand side, we have the healthcare practitioner, the doctor, the clinician, the nurse, the physiotherapist, the nutritionist, the dietitian. They are the people that make the recommendations, create the diagnosis, create the treatment plan. On the right-hand side, we have the health coach. The health coach supports the client to make choices about their health and to implement the recommendations and the advice of the healthcare practitioner. It's a non-clinical role of supporting behaviour change, of helping the client to set goals, to become self-accountable, to self-empower, and to achieve their health objectives.
So, turning our attention to UKIHCA, the association, this slide represents the three key elements of our activity. So on the left-hand side, professionalism. So as Isabella already mentioned, health coaching is currently an unregulated practice and discipline. So UKIHCA has set the standards for professionalism, by which we mean in education and training. So we're not a training provider, but we set the standards to which the courses aspire. And then we encourage the training providers to submit their courses. And if they meet the standards, which are complex, then they become approved courses. And that would be the normal route to membership, which we'll come on to in a moment, which is to graduate from an approved course to becoming a full approved member. So under professionalism, we also create the scope of practice for a health coach, which is very important and which we'll refer to more than once, I guess, in this presentation, but also the code of practice as well as the scope of practice. And then in terms of helping to reinforce those standards, we play a role in supporting and providing. Can you just put the slide back, please, Isabella?
Oh, sorry, I'm trying to let people into the meeting.
Yeah, so part of the support for professionalism is, again, we don't create CPD, but we approve CPD and promote CPD. And you'll see that coming down the line very soon will be services for supervision and mentoring. So then turning our attention to the membership, and this is under community. And we do see this as community. The majority of our 900 members, whether they're in training, approved or affiliates or portfolio, which we'll talk about in a second, the majority of our members are self-employed sole traders. And if that's you, you'll know that that can be a very lonely place to be. So we work hard to welcome all of our members to join a community, and there are lots of activities that we do. So we have informal meetings where you can just drop in, ask questions and get advice. We have a networking Facebook group, and of course we have a very comprehensive webinar program where all of our members, and indeed on this occasion the public, can join. And then enterprise, and this is where we increasingly spend a lot of time, because health coaching is still relatively new, and we work so hard, and I would say we probably apply something like 60 or 70% of our time and effort and resources on promoting health coaching and health coaches. And also we reach out to other communities that we want to engage with to promote the benefits of health coaches. And the very center of the white paper is this thought that health coaching is an enabler at the very center of all of the elements of healthcare in this case, but it could be across all cross-industry collaborations and bodies. So enterprise increasingly important, and in capitals there you can see emphasize lobbying, which of course was the primary reason we've written the white paper, is to get onto the agenda of the policymakers and the fund holders. Thank you. And speaking of the white paper, why have we written the white paper? Well, as we've already said, the time is now right. So health coaching is becoming more prominent and better understood. So we want to raise the awareness for the profession of health coaching and of our own association as the professional body. The paper sets out to explain health coaching, as Isabella has already eloquently set out, but not everybody understands. And it's clear that people don't understand what a health coach is. And so in the white paper, we do make that very clear, because we have to put it into the context of everything that we're asking for in terms of the recommendations. And it sets out the case for integrating health coaching as an evidence-based modality and foundational platform to every sector of society that's interested in improving Britain's health, which increasingly is across all sectors. And finally, it makes practical recommendations for how health coaching can integrate and support a variety of those sectors. So what's in it? Well, we're very pleased that Lord James Bethell has written the foreword, and James is not only a champion for public health, but he's a strong advocate for initiatives in public health and well-being, and he has lent his weight to this publication, so we're delighted for that. We talk about what it is that we're asking for. We set out very clearly an overview of the current crisis in the UK healthcare, which is, it's in the news every day, whether it's the NHS or other forms of healthcare. We are struggling to provide for the needs of the population. There's the explanation, as we've said, of health coaching so that people can put it into context. We'll talk about the role for health coaching within every sector, and we believe that it has a role to play in every sector. But more than that, the white paper then, importantly, presents evidence that for the efficacy of health coaching. And finally, having set all of that out, the white paper makes very clear recommendations for the integration of health coaching into and alongside a range of sectors.
Thanks, Ines. Well, healthcare, we have a problem, as Ines has alluded to, and we all evidence every day. So when we switch on our TVs, when we're listening to the radio, when we're looking at print media, when we're looking at social media, we have a deluge, a tsunami of statistics and issues. We know that the UK is amongst has the worst population health in Europe. 1 in 4 of us are challenged by 2 or more chronic disease conditions. 1 in 2 of us are facing a cancer diagnosis in our lifetime. The UK consumes more highly processed food than any other European country. 25% of our children aged 10 to 11 are overweight or obese. Excess drinking is the worst of 25 country studies. Physical inactivity is associated with 1 in 6 deaths, and some number of adults are inactive and at risk of developing physical and mental illnesses or death. Mental health issues affect 25% of our adults, 17% of children and young people. 1 in 6 children aged 5 to 6 have a probable mental health disorder. Thousands of us are dying each year from poor quality air, and others are suffering from long-term respiratory conditions. We have a sick population getting sicker. We have an aging population spending more years in declining health. And we have a reactive healthcare model where the NHS cannot make Britain healthier if its priority is to continue to treat ill health. Treating that sickness is consuming over 90% of our resources. So an overwhelmed NHS workforce who are unhealthy, who are stressed, depressed, suffering moral injury because the work that they're doing is not aligning with their values and their expectations and their own principles. They're disengaged and they're shrinking in number. We have a national workforce challenged by poor health and well-being, impacting their engagement, their attention, and of course their productivity. Some 2.5 million of us cannot work because we have long-term health conditions, or we have disability-led ill health conditions, including cancer. Anybody with a cancer diagnosis is legally entitled to disability benefits and to be treated with all of the things that we have available for people with disabilities. Did you know that? 1 in 2 of us are going to be facing a cancer diagnosis in our lifetime. 1 in 2 of us will be classified as disabled legally from that diagnosis alone. There's the impact of the long-term sickness on UK skills shortages within the workplace and the unproductive workforce on the UK economy. It is dismal. The challenges really are of an unparalleled proportion, and we need to pivot. We cannot keep on keeping on. So, as health coaches, as the UK and International Health Coaching Association, we're very much aware of this. And we're very much aware that we have in our hands a solution that it almost is too simple to be true. So we decided to have a look to see in the literature, in the media, in health, employment, physical activity sectors, who else was concerned as we were about the state of health and the state of the impact of Britain's poor health on the economy. Well, the NHS long-term plan, these are all voices from the field. These are all reports that we've given and evidenced in the white paper with a description of what they're saying and what they're asking for. And I'd just like to, I can't go into it in detail, but it's there for you to read. But I would like to give you some headlines of what the common language that we're all using here. So the NHS long-term plan sets out what the NHS will do to move to a new service model, where patients get more options, better support, joined up care at the right time in the optimal health setting. The NHS at 75 Priorities for the Future report has been put together by the NHS Assembly, which aims for a plan with three priorities: preventing ill health, personalising care, and delivering coordinated care closer to home. The Covenant for Health by James Bethel is one of the authors for the Covenant for Health, which I notice actually is missing from there, but it should be on there, is policies and partnerships to improve our National Health Service for 5 to 10 years. It's a cross-party document where James and his collaborators are saying that we need a new covenant for health to bring together businesses, the NHS, communities, and individuals. The NHS Mental Health of Children and Young People report for 2022 sets out the dire problems that we have in looking after the mental health of our children and young people, evidenced every day on the television and in the media. The NHS model for personalised care, which I will go into in a little bit more detail in a moment, centres around the person. It talks about population health management. It wants to improve the capability to improve prevention, enhance patient activation, and supported self-management. It encourages self-empowerment. It's a whole system approach. It wants to integrate services. It wants to build a new relationship between the patient, the professional, and healthcare resources. These are all words that we will use daily as health coaches in our industry. This is a common language that is emerging from a huge variety of cross-sector reports. The NHS Major Condition Strategy sets out, again, 1 in 4 of us are living with at least 2 chronic health conditions. Our population is becoming older and living with multi-morbidity. The Major Condition Strategy sets out a personal approach to prevention and the management of risk factors. This is the bread and butter of health coaching and lifestyle medicine. My Full Reality is a report by the Chronic Fatigue Syndrome collaboration, which tells us that some 241,000 children and adults in England are suffering from a very poorly understood and very debilitating condition called chronic fatigue syndrome. It wants to support children and adults to manage their condition, where possible to prevent it from worsening. It wants to support healthcare assessments and prevention activities. It wants us to provide professionals with the skills, experience, and resources to appropriately support these people. This is the bread and butter of health coaching. The King's Fund. The King's Fund is an independent strategic organisation. It's a non-profit. It's a strategic organisation which wants to set the context for healthcare in the future. Its main aims are to drive improvements in health and well-being across places and communities. It wants to improve health and care for people in the worst health outcomes projections. And it wants to support people and leaders working in healthcare. The King's Fund reports, if you're not familiar with them or not subscribed to them, I very much encourage you to follow them and read them, especially those of you who are health coaching and health coaches here this evening. The education that they provide is enormous. We talk about national voices. National voices are a group brought together by the NH Assembly of 50 members and people with lived experience to offer insights and recommendations on future directions. They talk about prevention, living healthier lives for longer, NHS community partnerships, personalisation. A quote from one of the participants in that report with lived experience. Every health coach here this evening will resonate. My recovery started when my clinician asked me what I really wanted. Not many clinicians know that they need to ask this question. Community Pharmacy England are the retail pharmacies, the ones that we see on the high street. There is a huge move for these pharmacies to becoming more and more integrated into primary care, into community care and looking after local populations. Some will say it is controversial, but there needs to be a joined up, responsive and person-centred, community-based health and care services where we bring high street pharmacies, GP practices and communities together. The Patients Association have defined 6 principles for valuing patient partnerships. Their recommendations are very simple, and again, they'll be completely understandable by all of us here this evening, I'm sure. Start with the patient. What is it that matters to them? Health professionals don't have to do everything. The patient can lead. Patients are the experts when it comes to themselves. It's not patient's story, it's patient evidence. Have each other's backs. Let's have patients and professionals working together to improve everyone's experience of the health service. Kindness and compassion, essential to good partnerships. Equity and access. How does the system ensure that nobody is left out? This report, I'd like a drink of water. Actually, Ines, would you just like to speak to unlocking potential?
Well, for those of you who don't know me, my background was primarily in the UK health and fitness sector. And so this is close to my heart. And for many, many years, particularly in fitness clubs in the private sector, battling with customer retention and particularly this time of year. So everybody starts with the motivation of the new year, new you. But of course, once that emotional motivation is overpowered by the lived reality of a wet Wednesday in February, and it's dark and it's cold and you don't want to go back out, that's where, you know, the role, I can't help but feel that the role of a health coach, if integrated into programs within sport, leisure, physical activity, fitness, as part of the service delivery, would absolutely transform the outcomes within that particular sector, not just for the clients, but also for the operators, the local authorities and the programme owners, funders, Sport England and the government. So that's a bit of a passion for me.
Thank you, Ines. We are delighted that the physical activity sector are boldly coming into the health space. It's high time that they too were recognised as health professionals and as a very important part of the collaboration of sectors who are wanting and aiming to improve the health of Britain. So we're delighted and we hope to work with them quite closely going forward. The CIPD, the Chartered Institute of Personnel Development, in 2023 asked the question, is the UK getting sicker? It quoted the Office of National Statistics report, which confirmed that UK sickness absence had increased, bringing us back to 2004 levels. So we're going back 20 years in 2023. The Office of National Statistics census data for 23 stated that the current annual bill of 19 billion for working age disability benefit was expected to rise by 33% in just 4 years' time. 19 billion rising by 33% in just 4 years' time. Healthcare, we have a problem.
And the UKIHCA today and within the white paper is positioning ourselves as the voice for health coaching. So this nice graphic on the left kind of condenses the white paper into a diagrammatic form where you've got a calling for an integrated policy and showing that health coaching, as we have been saying and we will continue to say, can be an enabler and a facilitator across sectors and across all of these elements that are contributors to the population health. And finally, following the proposition of what health coaching is and the situation within health provision currently, is making recommendations and showing how health coaching can work across all sectors. So the premise, a proactive and preventative approach to health and well-being, which health coaching is. Position is a health coaching approach to be at the forefront of every health and well-being relationship. And we believe that that is practical and possible. And the proposition, improvements in population health and well-being through the integration of and access to the non-clinical evidence-based intervention of health coaching into clinical and patient pathways, prevention programs, workplace, education environments, and communities.
Okay, so
yeah, carry on.
We've heard a consensus calling for action to deliver a whole health and person-centred focused healthcare, which considers individual needs and provides an integrated care approach. We want to drive a sustainable and personalised healthcare for the future, which addresses health inequalities and access to care. The consensus says we want to value add healthcare by investing in prevention and health promotion, both being cost-effective approaches with positive long-term outcomes for individuals and for populations. But as Richard Murray, the former CEO of the King's Fund, I see a new CEO has just been appointed, says tackling this problem is not just a job for the NHS. We cannot treat our way out of a public health crisis. So it means that collaborating is absolutely the only way to go. So a whole health coaching approach, we are saying, is to underpin a collaboration of the kind that will stand a chance of making a dent in the current crisis that we're in. A whole health coaching approach is an approach which is applied within a specific context of whole health outcomes. It's more than behaviour change. It explores the whole human experience, one's belief, identity, values, and spirituality. It's fundamental to that long biopsychosocial, emotional, as existential descriptor that we talked about earlier. It acknowledges the importance of the individual unique lived experience. It focuses on evidence-based, strongly evidence-based theories of behaviour change and uses specific tools, of which most motivational interviewing is probably the best known to clinical practitioners, but there's a whole lot more. And it draws on a number of well-grounded coaching concepts such as self-efficacy and goal setting. So these are the kinds of features of health coaching which are not commonly seen in other disciplines. So we believe that a coaching approach is something that every discipline can learn to integrate into their own portfolio of skills, but also to work with a professionally qualified and well-trained health coach who can support them in the job that they've been trained to do. In 2020, the UKIHCA Standards Review Group, which is a cross-sector review group, defined health coaching as a client-led collaborative process that promotes self-management, self-empowerment, equips an individual to adapt positively to their internal and external environment. And it talks about resilience through the pursuit of activities and a lifestyle that cultivates that whole health continuum. So I've brought this back full circle really to demonstrate how closely aligned the language and the concepts and the underpinning purpose and values of health coaching is with the consensus that we need to pivot, and the voices from the field who are all calling, maybe in slightly different semantics, for the same things that we are. And just to give those of you a picture overall of the kind of coaching relationship for those of you who are not health coaches, you can see that on the left-hand side of the screen at the top is the coachee. They are bringing to that coaching relationship purpose and meaning, their vision, their values, their strengths. They're there to address their challenges, make choices, and decide what they want to change in terms of their lifestyle and in terms of behaviours. The coach, on the other hand, is in partnership. They're an ally. It's a non-directive discipline. It's a non-directive approach where the coach will say, what is it that I can do to support you to make all of those things on that left-hand side happen? So the health coach understands the whole health continuum, has a foundational health knowledge, understands well-being and wellness, and how that individual can have, they and the coach can work together to build resilience. So what's the evidence that all this works? We've made a lot of saying that health coaching should be at the centre of the earth. However, there is a lot of evidence and it gets stronger every day. And within the report, this is all set out clearly with links. So Sforzo is probably the most comprehensive, a compendium of the health and wellness coaching literature, where a number of studies, a large number of studies are reviewed, and the conclusion is, yes, it works, it's useful, it makes a difference. The NHS itself, in its workforce development framework, Appendix 1, all of these links, for those of you who are interested, are in the report. So you can link to those reports and read them or download them. The NHS Workforce Development Framework itself, the NHS employs probably in excess now of 1,500 health coaches, health and wellbeing coaches in general practice and a few elsewhere. Sets out the evidence, better conversation. A website has a whole page of evidence. More recently, the University of Southern Denmark and Lever Healthcare have reported on a long-term weight loss supported study in primary care, evidence for e-health coaching programs, and a randomized controlled trial, which, as you probably know, is the creme de la creme. This means that people are randomized into the group that receives the intervention and those that don't receive the intervention, and the results are compared. ARAHA in 2023 looked at the critical success factors in integrative care for chronic disease patient or chronic fatigue patients. A patient needs resources model found a very strong evidence for supported health coaching. Arman looked at sustained gains in a rapid systematic review. Are beneficial coaching changes still evident more than 6 months after the cessation of a 6-month programme? The answer is yes, in fact, several years after the cessation of that programme. In the UK, Dr. David Unwin looked at how health coaching and a group intervention in the community could support people to come off diabetes medication. Fantastic results, huge amounts. So I think it's something like £76,000 saved from the prescribing budget for just that practice alone. And more recently, Health Navigator has produced a data for us that looked at how mortality was halved for older males receiving AI screening, artificial intelligence screening with personalised coaching. The evidence for this kind of intervention is increasing daily. The studies are developing in their complexity and in the way that they are able to bring to us the evidence that actually health coaching, yes, it does work. And now we have more than 75 recommendations within the report itself. Now, obviously, I can't read through every one, but I have marked up a few that you might be interested to know. For instance, in health policy, we are saying that we want to ensure that adequate funding is prioritised for robust and continuing education, for the certification, the education and the training of well-trained health coaches in all contexts in Britain. We want to recognise that the different levels of health coaching in practice, from entry levels through to extensively trained and experienced specialist health coaches, can be supported. In terms of collaboration within health policy, we want to see the wide recognition of that whole health paradigm and move to engage and combine inputs and efforts from other organisations and specialists across industries, so that all industries, the education industry, if you will, the physical activity sector, the employment sector, see people as whole beings, whole people with whole health in a whole lifestyle. We want to see specific recommendations, for instance, to place an obligation for ICSs, integrated care systems, to enable the integration of health coaches into health and wellbeing activities in primary care, in secondary care, in social care agencies, within public and physical activity facilities, within education and within workplaces. Within clinical medicine, we want to see the integration of health coaching into primary and secondary care to establish routine referral pathways and measure clinical outcomes, physical and psychological parameters, to collect the evidence, to publish the outcomes on the value-based care model. We want joined up healthcare, and we want joined up studies that trace the path of an individual through their primary and their secondary care experience. And we want the data to show that health coaching improves the experience and lowers costs there. In patient-initiated follow-up, PIFU, we want to identify the patients at risk of deterioration when they're suffering from chronic health conditions. And these conditions can be managed and even reversed with lifestyle and behavioural change. We want to prioritise the patients for whom we can do the best. And we want to integrate health coaching into personalised PIFU programmes, with health coaches collaborating with hospitals and with primary care clinicians, as I've just said. Within the personalised care model, and I'll come back to that in a moment, we want to prioritise whole health care for 100% of the population, with lifestyle and behaviour change improvement programmes in schools, in universities, in communities, in workplaces, supported by qualified health coaches. We'll have a look at that model in a moment. We want to put whole health coaching and well-being literacy, including physical literacy, at the heart of a curriculum for life. For people with long-term health conditions, we want to integrate joint working between social prescribers and health coaches and curb the overprescribing of drugs and medication. And for people with complex needs, we want to integrate working practices between social prescribing and health coaches to tackle isolation, mental health issues, and promote a sense of empowerment, health and well-being. And I'll just, if I can, there is the comprehensive personalised care model. And what I'd like to point out is that that dark blue foundation for 100% of the population, supporting people to stay well, to build community resilience, to enable people to make informed decisions and choices when it comes to their health changes, and supporting a universal shared decision-making model is absolutely the bread and butter of health coaching. And health coaches and health coaching integrated into a clinician's portfolio can make a huge impact on 100% of the population. For those people with the long-term physical and mental health conditions, some 30% that I've just mentioned, supporting them to build their knowledge and confidence in their skills to live well with those conditions, and even in some cases to ameliorate them and to prevent them from worsening. And sometimes, as we've seen with diabetes, at one point it was deemed we couldn't, it was a lifelong condition. Now we see people reversing it through dietary, through lifestyle changes. Health coaching is a huge supporter of that. And for those with complex needs, empowering people to help and manage their conditions better themselves, to reduce their reliance on unplanned care, and to increase their autonomy and their experience and their quality of life. Hugely important. Another very important role for health coaching. I can now make my mouse behave itself. We turn to retail pharmacies. These are the high street pharmacies where we know that there are moves now to encourage integrated joint working between social prescribers, health coaches and pharmacies to curb the over-prescribing of drugs and medications, and to encourage and support community pharmacies to develop health coaching knowledge themselves and to offer access to health coaches within those pharmacies. Huge opportunity to have a triad of the general practice, primary care, community high street pharmacies, social prescribers and health coaches working together in that joined up relationship. This is what we see is the potential, and health coaching can be a foundational underpinning of that relationship. In terms of preventive health medicine, integrating coaching into health promotion, into illness prevention strategies at individual and group and community and population levels, and supporting lifestyle modification and sustainable behaviour change at scale is possible. Health literacy and health coaching. We have very low health literacy. The average reading age of our population is 7 years old. People's understanding, of general public's understanding of their health and health terms is very problematic and very challenging, especially for those who have English as their second language. Improving health literacy is hugely important. Health coaches have a huge role to play as educators, non-directive educators, helping people understand much more about how their health works. In terms of digital health and health coaching, we want to see the democratization of access to health coaching through digital technologies. Yes, through SMS, through emails, through video calls, through apps, integrating the benefits of health coaching into busy people's lives. We want to see programs which support the general public to become confident with digital health technologies. We want to see widening opportunities to access shared digital technologies at GP practices, group health coaching in communities, and village halls through digital means. These are all very many things that have been promoted in America and have been shown to work. So we've got models for this. Health coaching and physical activity. I think Ines has ably demonstrated that within the physical activity sector, there is a role to play for health coaching skills and understanding and a foundational level of health coaching knowledge to be integrated into physical activity professionals' portfolio, working with a highly trained health coach to help their clients change and sustain behaviour in that whole health model. Foundations for Wellbeing. We want to see health coaching integrated into school and education programmes right from the start. Health and well-being is a right, just as much a right for our primary school children through secondary and further and higher education. We know that the state of students' mental and physical health now, with the reliance on ultra-processed foods and poor diets, is not good. We want to see health coaching integrated into that educational sector. Within communities, connected communities are something that every health professional will agree we've lost. We need to rebuild those communities, and we believe that health coaches and health coaching can be a mechanism by which communities can become closer, can be trained and supported and facilitated to promote their own health. We know that community health initiatives work well. There is always the small gathering of parents at schools, the mums at the school gates, the people of different cultures and religions in the temples or the mosque that can support each other. I personally have had a lot of experience working in that particular area. I know it works. Health coaching is something that can facilitate those communities to help themselves and to support themselves and to empower themselves with that knowledge. Social prescribing, we've talked about. For those who are not familiar with social prescribing, it's a mechanism by which people who maybe do not need a prescription, a medical prescription, can get a social prescription where they can be encouraged to be integrated back into the community, to find a community of people that can support them in building up their confidence, their skills. It might be a gym membership, it might be access to a gardening club or a walking club, or anything that is actually community based. Social prescribing link workers are the people who will talk to a client, talk to a patient, find out what's important to them, what they'd like to achieve, and introduce them to those activities and resources. Huge range of resources. I've just named a couple in the community. These are extremely informed local people who know what's going on in their locality, working together with a health coach, but they're not trained in behaviour change. So we say, let's work closely with social prescribers. Let the health coach and the social prescriber work in partnership to not only reintroduce patients and clients into the resources that are available for them in the community, but also to make sure that they change behaviour, that they can see the point of going, and that they develop internal and intrinsic motivation and self-empowerment, and actually become advocates for their own health. And as Rangan Chatterjee would say, architects of their own health and well-being. Workplace and wellness. We've looked at briefly at the implications of an unhealthy workforce, or an unhealthy population, I should say, on the impact of that on the workplace. So it's not just about well-being, it's not just about people's mental health and psychological buy-in as an employee. We have a workforce who is struggling with their physical health conditions. You cannot have a healthy mind without a healthy body. You cannot have workplace well-being without physical well-being in that workplace. We say it's very important for the health sector at large to be working with leaders and employers in the employment sector to support their employees' health, because after all, every employee is potentially a patient. Most patients are employees. We believe that health coaching, working across those two sectors, can support that employee, that client, that patient to have a better quality of life and to address their health issues. And we're also, as an association, working towards a quality kite mark for employers who take seriously those kinds of initiatives. We've talked about this now. Whoops. So Ines, over to you.
So kind of in summary, but what this graphic serves to do is as we've seen in many other representations, health coaching is at the center of so many disciplines and activities. And this word scope is essentially plucking words and terminologies from the white paper. You can see the relevance, the health, preventative care, communities that we've been talking about, the fact that it works because it's evidenced, and it's a driver for behavioural change. So it's a very striking representation of the pages and pages of proposition and evidence that are within the white paper. And health coaching partners with and contributes to the aims, objectives, and results of every sector concerned with working towards a healthier, happier Britain, which is ultimately the goal.
Indeed. So, my friends, there can be no better time to step out of our professional silos, to demonstrate humility and to work together for better. And I strongly encourage you to, if you haven't yet downloaded the white paper, please do so. Pain points and solutions, as I've already outlined, is an executive summary of the key issues that we're facing, that we went through that miserable list of healthcare, we have a problem, to highlight the solutions that we believe that health coaching can be at the centre of and provide the foundation for. Let's not forget that this is a non-clinical discipline. It doesn't aim to be a clinical discipline where we are solving or treating or diagnosing. We are here offering behavior change, offering self-empowerment, offering the ability to set goals, to become self-accountable, to go deep inside and say, what is it that I want my health for? And to help that client or that patient on their journey towards better health. And the recommendations that we make are the ways in which we've envisioned that we can be useful. So that is the white paper. These are our, you'll all get a copy of this, a recording of this webinar, so you can see our contact details there. If you want to write in with comments, observations, ideas, if you have anything that you would like to share with us, any suggestions, any help you'd like to give us to get our message out there, please do get in touch. And I would now like, we've got probably 20 minutes left. So if anybody wants to ask a question.
So I'm just, while people are thinking about their questions, just to amplify a note that I put into the message there, that if you are interested in promoting the business case for health coaching and amplifying the message of the white paper, you can look out for our posts on all the socials, and please, like them and share them. Make comment on them and amplify those into your communities, and that's the way that we can raise awareness and really leverage this very powerful tool that we have.
Okay, so anybody want to ask a question? Anybody interested in knowing a little bit more or having any clarification on anything? I'd be pleased to help, and I'm sure Ines would. Any observations, any offers of help would be great. Not necessarily this evening, but please do contact us. Let us know what you think. Let us know what you feel about the white paper. We are going to be promoting it throughout the year, so it's not just we've launched it and there we go. It will absolutely be promoted throughout the rest of the year. We've got more webinars coming up. On the 14th, we have a great webinar coming up with which is looking at how we can support the employment, the workplace. We've got coaches who are involved in the workplace. We've got a wonderful employer who is looking at providing health coaching programs. Sheila Kisan, who who is a huge supporter of health coaching. And throughout the year, we will be picking up themes from the white paper, creating articles, joint articles with colleagues across the health, education, physical activity, healthcare sector. Look out for an article that will be published in NHSE that Dr. Penny Kehayoglu, one of our advisors, and myself have written based on this white paper. So there will be plenty in there. You can help us by sharing our posts, by commenting on them, by giving us suggestions, introducing colleagues that you might know in your or contacts that you might have, either within the political and lobbying space or within those other sectors that you think might be interested in having a conversation. We have been opening so many conversations on on the topic of the white paper over the last even just 2 months. If you just take out Christmas, it's already the end of January, my goodness. But we just encourage you to become active, to help us and help yourselves and help this profession grow and get the recognition and the support that we all know that it deserves. So with that, is there any more for any more? Would anybody like to say anything?
Actually, yeah. Hi, I'm Simone. I'm a CE for lung health coach, and I'm on the sort of I work with the asthma clinics as well. So we're sort of going into respiratory health and trying to get into the NHS that way. But working with asthma, have you reached out to other charities perhaps? Or because they're trying to, the asthma obviously are looking at the respiratory side of things. But there must be other charities maybe that would want to educate and might be a good vehicle to sort of get the message out.
We have, Simone, we have a list of charities and advocacies on our database. And we have sent the white paper to what we hope is the relevant representative of that charity. We do a lot with the cancer charities. So we have because of the demography of the cancer and the appalling prospect that we're facing. So we have very close connections. Dr. Penny Kehayoglu is a consultant oncologist, and I'm doing a webinar with her in, I think it's about the 22nd of February for the British Society for Integrative Oncology, where we're talking about the role of health coaching and the need for everybody really to be reading that white paper and seeing for themselves how integrating health coaching. We want to see we are a professional body. We want to see that profession grow, but we also want to see health coaching as a modality integrated everywhere, because everybody needs that as part of if they're involved in community development, in community care, in healthcare, in the employment sector, teachers, university teachers, physical activity professionals, health promotion, everybody needs a little bit of those health coaching skills to open those conversations with their clients or their patients. And we need we've got now probably nearly, I'd say about 2,500, so we've 900, 1,500, nearing 3,000 people who are trained and qualified health coaches. We need many, many more, but we'll get there. And we hope that this white paper will help us get there. So thank you, Simone, for that. And we hope you'll share it with your contacts in your network.
Yes.
Sarah has raised a hand, but where?
Hi. Hi. Thanks, Isabella. I just had to jump in there after Simone. Hi, I'm the head of physical activity at Asthma and Lung UK, Simone. So it's nice to see you. Just to say that I sit on the Richmond group of charities, Isabella, and I will be taking this to them in the work that we're doing collectively with We're Undefeatable as well. So I'm starting my coaching course next week to become a health coach as well as my role. And yeah, it's really great to see so much of the work that we're doing in the paper, and so many new things as well that we can start to introduce. So I'll message you separately, Isabella, because there might be something that I can do with the Richmond group.
Thank you so much. That's lovely. I mean, it's wonderful. I really do hope. We don't expect to be able to change the world overnight, but change the world we will. You can be sure of that. You know, we have to, because if not us, then who? Somebody very famous once said, I think, you know. So yeah, anybody with an idea, anybody who would like to just say, do you know, I think so and so might be interested in this, either please do forward the paper to them or write to me at ceo@ukihca.com, and we will we'll take you up on whatever advice, offers, suggestions, introductions that you can.
Isabella, just to emphasise also, you know, the need for more evidence. Although we've documented lots of evidence, you know, we're looking for more evidence from across sectors. So whether it's in the corporate sector, whether it's in the physical activity sector, the health sector, the mental health sector, wherever it might be, community care, we're looking for evidence where health coaching has been applied and has got good documented evidence to support modalities, because it's just all more power to our elbow.
We know that the NHS, actually, there's a lot of evidence from the NHS. The NHS has, as I say, probably now in excess of 1,500 health coaches employed as health and wellbeing coaches under what's called the additional roles scheme. Many of those, probably most of them, are employed within general practices, but it is broadening now. And of course, all of them will be collecting evidence. So that evidence bank will be growing. In the white paper, I've just taken a selection because I couldn't replicate Sforzo's compendium of health and wellness coaching evidence, although I'd love to have done. But we know that as time goes on, and actually very importantly, we need to collect our own evidence. So we are at the association, as our resources allow, building a research function where we already have in place a research associate. Anastasia Den Blanken has come as a volunteer, and she will be working with a number of us to start building our own research database, which will draw in research from every quarter really and build up our own database here in the UK. It's all about resources really, and you know, as a non-profit that has a very limited budget, we have to just do what we can with what we've got, but we are hoping now, well, we are starting this year to build that research database. So that's good news for us. Anything else anybody would like to say? No?
I just responding to a note there from H Blackburn. Sorry, I'm H, not sure. I've missed your first name, but talking about, are we working with the 43 funded active partnerships that are funded by Sport England, who we mentioned as part of the presentation? And I'm pleased to say that we are speaking to active partnerships. But the point I was making is we're kind of trying to navigate the landscape, which can be complex. But we absolutely believe that health coaching can be integrated into many of the pathways that they talk about active places within localization. So that's working with local experts who understand what resources and programs are available locally. So we're very, very keen to understand more about that and how to plug into that funding and to incorporate and integrate health coaching to improve the outcomes of the clients on those pathways. So if and that goes for any sector, because there are nuances in all of these sectors and the organizations and the multiple quangos, etc., that we have to try to understand. So we would certainly welcome help in navigating all of that as best we can.
Thank you. Amanda Roberts, I'm just scrolling here through the chat. Amanda, you've said, I attended SHW Live Expo in Manchester. Health, safety and well-being. I could see a UKIHCA stand, keynote speakers fitting in there. Yeah, we can too. We've increased our reach for conferences this year, and we will be at a number of workplace health and well-being conferences, and also physical activity conferences as well. So we've traditionally not been in that space, but with the white paper now, it's all where can we go next to spread the message, and we will do so.
Oh, that's great. Thanks, Isabella.
So Morag Andover says, such huge potential for UKIHCA to bring health coaching to the front of everyone's mind. Thank you. I'm looking forward to doing my part. And I think, that will be the thing. We will all have to do this for ourselves. Every health coach in this country is the best advocate for health coaching. We can't do it all. We need those top-down policies. We need to collaborate with other sectors. We need to impress upon them the unique contribution that we can bring with our skills, and we need to show how we can work to support the skills that they are trained for and the work that they're doing. And it really is a no-brainer. If we can crack this nut, I think we can really, really make a huge difference to population health. I'm not saying it's the only thing that needs to be done by any means, but my goodness, we need a foundation, and that foundation is getting people to understand more about their health, more about their lifestyle, more about the fact that lifestyle is medicine, more about the fact that they can change and that there is support for them. These factors all have to be brought into the mix. So we see actually a huge role for lifestyle medicine to be education, to be brought into schools, to be brought into the workplace. There is abundant evidence. We don't have to prove anything. We have it here. We just have to get people to listen and take action, and take the leaders from those organisations where, if you read the report, we have a couple of quotes where we are saying it is about the leadership. The leadership has to now come out of that silo, work with each other. The King's Fund, always advocating for collaborative leadership, and that the fact that the paradigm has to shift. It's there's a saying, I think actually Hillary Clinton said it at some point, about it taking a village to raise a child. Okay, it takes a village to raise a child. Well, we say if that child is public health, then it takes a society to raise that child. So as a society, we have to come together and collaborate And this involves the general public being encouraged to understand that they have efficacy, that they have self-empowerment, that they can make a difference in their own lives. And that is a huge job for health coaches, and they do it very well. Every single person that's been here this evening who has worked with a client in a health coaching capacity or a patient understands the power that is unleashed when an individual realizes that, yes, they can make a difference in their own life, and that you as a supporter have supported them to do that. It's beyond words, really, the reward that and that will shine through all of those systems when we get it going. Okay, where are we? We're about on 9 o'clock now, so I haven't gone through all of the I'm trying to just pick up on anything here. I'd like to thank you all for coming this evening and for listening, and all of you for participating in the chat, for making comments. Please reach out subsequently with anything else that you may think of or that occurs to you, and we will be very happy to have a conversation with you, to have an email exchange, and to garner your energy and support for a healthier, happier Britain, to make the case for health coaching.